The causes of ovulation pain. We are going to look at the causes of ovulation pain. In this video today, you are going to learn about the causes of ovulation pain. GERALD MASSA, the health educator, is the name of the channel. I welcome you, my friend, and thank you for subscribing. Every day you are going to learn new things about women health, and today we are talking about the causes of ovulation pain. So without further ado, remember, if you have any questions, you can always connect with me. Consultation is free of charge on my WhatsApp numbers, and we shall go straight away to the causes of ovulation pain. GERALD MASSA, the health educator, is the name of the channel. We are talking about the causes of ovulation pain. So the term ovulation simply means the release of a mature egg. A woman releases a mature egg, and this normally happens once every month. So the release of a mature egg is what we call ovulation. So when this process is happening, there are some women who experience pain, and we call this the ovulation pain. So in this video, we are going to talk about the causes of ovulation pain. Without further ado, we shall first of all define, we've defined the ovulation, and we have talked about it. We've said this is basically the release of a mature egg. We know that when we look at the calendar, normally the release of a mature egg happens once, and this is normally on the 14th day. So we know that if at all you see your menses, maybe for the first 3 days or the first 4 days, you specifically have to count 14 days from the first day you saw your periods. So to answer today's question, we've defined ovulation pain. We are going to go straight away to the causes of ovulation pain, and the first cause of ovulation pain is normally when there is swelling or rupturing of a follicle on the ovary. One thing we shall realize is that the ovary has follicles. The follicles are those storage organs. They are the parts where the egg is stored. So when they are about to release an egg on the 14th day, normally they do swell, and as a result they do release some fluid, and this fluid normally brings about a dull egg. So the first cause of ovulation pain is swelling or rupturing of a follicle on the ovary. Normally this is something which can be managed, and the next cause of ovulation pain is when the egg itself bursts out of the follicle. The first step, we said, normally the follicle will begin by swelling. The next is the egg bursts out of the follicle, and normally when the egg bursts out of the follicle, there's going to be a sharp pain, and this normally can be on one side. It can be on the left side or on the right side. But out of experience, many of our clients, our female clients who complain of ovulation pain, they tend to experience the pain on the left side. We are talking about the causes of ovulation pain, and we have said that the first cause is the swelling of a follicle, and then the next is the egg bursting out of the follicle. Next cause of ovulation pain is spasms of the fallopian tubes of the uterus as ovulation approaches. We actually have some clients saying that if at all they get that ovulation pain, it is one of the signs they use to really predict that probably maybe ovulation is coming. But normally, remember, pain could be due to something else. Much as you may think that the pain is due to ovulation, but still it's always good to consult your doctor and to have tests done, because the pain could also be indicating that something else is happening. Probably it could be endometriosis, it could be a PID. So spasms of the fallopian tubes of the uterus as ovulation approaches also is known to cause ovulation pain. Next is infection of the fallopian tubes, also known as hydrosalpingitis, due to poorly treated urine tract infections, can also bring about ovulation pain. So when there's infection of the fallopian tubes, this normally leads to intense ovulation pain, and it is actually known to land women in the emergency room. A woman can end up in the emergency room simply because of ovulation pain. So whenever you feel pain on your sides, it's always very important to have yourself checked out, because much as we may think of something else, but it could be ovulation pain, or it could be disease of the reproductive system. We are talking about the causes of ovulation pain. GERALD MASSA, the health educator. On this channel, we talk about the ovulation calendar, ovulation calculator, and pregnancy tips. So we have said that the first cause of ovulation pain is swelling of the follicles on the ovary. The next is bursting of the follicle to release the egg, and then next we've talked about infection of the fallopian tubes, bringing about spasms. Spasms are the same as contractions. So we are moving on to our next cause of ovulation pain, and we have said that fibroids and ovarian cysts can also cause mid-cycle pains. Whenever you are feeling pains, do not take it simply that it could be ovulation pain. It could also be due to fibroids and ovarian cysts. When we talk of fibroids, these are smooth muscle swellings, or these are swellings which are found in the uterus or outside the uterus. They can be intrauterine or extrauterine. Fibroids are normally brought about by excessive levels of hormones, specifically the estrogen hormone. When it is in excess, it is known to bring about abnormal growths, also known as fibroids. There could also be other causes of fibroids, but the commonest is imbalances in the fertility hormones. Ovarian cysts are also mostly hormonal. Where the egg came from, remember we talked of swelling and then bursting of the follicles. What remains behind is what is known as the corpus luteum. Whenever it becomes fluid filled, it can end up being called a corpus luteal cyst. Normally, when this is low, beyond when it is still small, beyond when it is around 1 to 2 centimeters, it may actually resolve on its own. And when you go to your doctor will tell you that let us use the procedure or the management of watch and wait. It can actually disappear, it can disintegrate on itself. But if it increases in size and it causes more severe pain, then it is very important to have yourself get checked up. So we are talking about the causes of ovulation pain. We have talked about the swelling of the follicles, the bursting of the egg, and then also infection in the tubes, and we have talked about fibroids and also cysts. One thing we should take home from this lesson of today, causes of ovulation pain, is that whenever you are feeling pain, abdominal pain, which is either mild or severe, please do not sit at home. You need to find help. You need to go and get treated. You could actually use some first aid remedies. For example, applying warm compresses on the side where you're getting the pain. You could actually also opt or get some over-the-counter medications or pain relievers. For example, ibuprofen. You should talk to your doctor if you react to some drugs, so that they do not give you some drugs. But ibuprofen and acetaminophen is known to relieve the pain. But if you take the pain relievers medications, but still the ovulation pain, the pain still persists, then it is high time you talk to your doctor, who will order for an ultrasound scan to be done, and also some other tests. The causes of ovulation pain is the topic for today. And remember, when you have any questions, talk to me on my WhatsApp. I will answer all your questions. Consultation is free of charge. So the next cause of ovulation pain is ovarian hyperstimulation syndrome, which usually occurs in women taking some fertility drugs, for example, the clomid and then letrozole. This can cause severe pelvic pain. Whenever you are taking fertility medications, whenever you are taking clomid or letrozole medications to stimulate ovulation, you should follow your doctor's advice. Clomid is available in strengths of 50 milligrams per tablet. You should not exceed the dose. You should not say that because you want to get pregnant faster, maybe let me take 3 tablets, let me take 2 tablets. It is not advisable. Whenever you overdose yourself on fertility medications, you can end up with a condition also known as ovarian hyperstimulation syndrome, which brings about enlargement and swelling of the ovaries, and normally they become hyperstimulated, as the name suggests, and this can lead to emergencies because they can be rupture, or the ovaries can end up even like bursting, and normally it can bring about complications, for example ascites, fluid filling your abdomen, and then also you can easily end up in the theater on the operation table. So always make sure that you follow your doctor's advice. Clomid for women trying to get pregnant should be taken at least 1 tablet once a day for only 5 days. Do not exceed the 5 days until you've seen your doctor, who will probably order for another cycle. Normally the maximum for Clomid, the maximum period should be at least 3 cycles. You try 3 consecutive times. If they do not work out, and then you have to give yourself some rest, wait a bit, relax, and then repeat after at least maybe 6 months or after 1 year. But this should be given to you by your doctor. Remember, on this channel, Gerald MASSA, the health educator, we talk about health education. We health educate you. This is for information only purposes. Basically, we give you the information, but you should also get a second opinion from your doctor before you begin on any medications. So we have talked about the causes of ovulation pain, and I really thank you, my friend, for staying with me all this while. And we are talking about the next cause of ovulation pain, and this is known as endometriosis. Endometriosis is known to cause ovulation pain. It's known to cause severe pelvic pain, pain you feel around your sides. This is actually growth of uterine tissue outside the uterus, because we know that the uterus has at least 3 layers. It has 3 layers of tissue. It has the outer layer, which is known as the perimetria, and then it has the inner layer known as the myometrium, and then it has the innermost layer where normally the baby grows. It's known as the endometrium. On an ultrasound scan, this can be shown very well. Next time you do the ultrasound scan, talk to your doctor about these layers of muscle. Your doctor will show you on ultrasound scan how they appear. So uterine tissue is supposed to grow specifically in the uterus, but in some women you may discover that they have a problem whereby the uterine tissue, or part of the uterus, the part of the tissue which makes up the uterus, is growing outside the uterus. Subabdominal is an abnormality which normally causes severe pelvic pain. For all our friends out there, all our women out there, whenever you feel severe pain, you've taken painkillers, you've taken over-the-counter medications, you've done some first aid remedies at home, and things are not working out, do not sit at home. It could be anything of these things we've talked about. It could actually be fibroids. It could be due to maybe ovulation pain. It could be due to probably maybe ovarian cysts in your system. It could be ovarian hyperstimulation syndrome if you are on fertility medications. Gerald MASSA, the health educator, is the name of the channel. Remember, getting pregnant is a journey. If at all you are trying to get pregnant, my best advice is always relax. Do not stress too much. The best thing you can do is you need to talk to an expert. You can talk to your doctor, you can talk to your fertility expert, you can talk to anyone to anyone who is an expert, so that they can give you the best advice. You can always discover the cause of maybe the failure to get pregnant. When you get advice, at least you can proceed on the journey of getting pregnant when you know what your dealing with. So it is always advisable for couples trying to get pregnant to seek advice. You can talk to me, on my WhatsApp, you can talk to your doctor who is nearer to you, you can talk to your gynecologist. When you get the best advice, when you do the investigations or the checkups, you do the pelvic ultrasound scan, you do the fertility hormonal screen test, you do the urine analysis tests for infections and for changes in your urine, normally you can discover the cause. And also sometimes you may think of something being big. Maybe you could think of there's a fibroid, but when you do an ultrasound scan, you may discover that your system is okay, you don't have any fibroids, and probably you need to work on the stress. So remember to subscribe for new videos. GERALD MASSA, the health educator, is the name of the channel. We talk about the ovulation calendar, ovulation calculator, and pregnancy tips. Remember to ask me all your questions on my WhatsApp. I will be very happy to talk to you. My WhatsApp numbers are +256 701 7978 76 and +256 787 668 962. WhatsApp consultations or any consultations you need, it's free of charge. You can also connect with me in case you have any questions down below in the comments. Leave your questions. I will answer all your questions as soon as I see them. May God bless and protect us all. Subscribe for new videos, and please have yourself a fantastic and healthy day. Don't forget to check the description for details. See you in my next video, and God bless. Bye-bye. Hello, welcome to our channel. I'm GERALD MASSA, the health educator. On this channel, we talk about pregnancy related questions. We answer all your pregnancy related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome. The ovulation calendar, get pregnant faster, the complete guide. Ovulation calendar, get pregnant faster, the complete guide. This is my new ebook. It talks about ovulation. It talks about all the rules you need to follow, everything you need to follow if you are looking at getting pregnant. Get your ebook right now. Order for it on my WhatsApp. You can send me a message. It is +256 701 7978 76. You could also send me a WhatsApp on my other number. It is +256 787 668 962. Order by email. Also, you can send me an email on ovulationebook@gmail.com. That is ovulationebook@gmail.com. Get your ebook right now. If you are looking at getting pregnant, you will read it. There are lots of steps to follow. They are easy to understand. Get this ebook right now. It goes for only $20 US. Order for your ebook at only $20 US. Send me a message and I will show you how you can purchase your ebook. When you get this ebook, you'll be able to determine ovulation. You will understand the common problems with ovulation, the common drugs for ovulation, and then also you'll be able to improve male fertility, because you may be thinking that you have issues when there are issues with your partner, when maybe he has issues with low sperm count, poor sperm quality. So I talk about all this in this ebook, and then also you'll be able to determine, you'll also be able to have sex, and then of course to determine gender selection. You'll be able to time sex for gender selection, and then also you'll be able to have all your questions answered about ovulation. Get this ebook right now, because the biggest problem most women seem to have with getting pregnant is determining when they are ovulating, and then their most fertile time to be pregnant. In this ebook, I've got all this covered. Just order for your ebook today, and you will be able to know, you'll be able to begin on this journey of getting pregnant very easily, knowing that you have a guide, you have a book you are reading, and it's giving you tried and tested information which has worked for many women. It has worked for many couples. Get your ebook right now. To order, send me a message on +256 701 7978 8 and 76. That is +256 701 7978 76. You could also send me a WhatsApp on my number. It's also +256 787 668 962. Send me a message showing your interest, and I will show you how to order for your ebook, how you can purchase it. It will be delivered straight to your email once you submit all the details. And then also you could send me an email on ovulationebook@gmail.com. Get your ebook right now. Ovulation Calendar, Get Pregnant Faster, the complete guide. It goes for only $20 US. Gerald MASSA, the health educator, are my names, and please connect with me and you'll be able to get this ebook. Have yourself a fantastic and healthy day. Bye bye.